One particular clinic in Chennai, they use 7 o'clock blades to do the hair transplant. He doesn't get to meet his surgeon anymore. Or if you look at Elon Musk, and he's in. So women mostly are comfortable with it. We've been there in the field for 2 decades now. We should have learned our lessons by now. People experience good results because if you're coming for the right reason, hair transplant is the best treatment for you. Now I've actually got clients 21, 23, young boys. It doesn't work like that. There's a lot of scam going on. So these places where they provide 2 rupees per hair, I've seen in an auto there was it stuck like, if you look at Avesham movie, you look at Fahad Fasal, they show him if you buy it cheap, you buy it twice. Hi, this is Dr. Nikita from Max Hair Clinic. Today I'm going to talk everything and anything about hair. But today I'm going to talk in detail about hair transplants and the procedures for hair. But if you're still concerned about why you're losing hair or what kind of hair fall this is, make sure you check out our previous podcast where I talk in detail about that.
So this is one of the most asked questions, Mom. What's the difference between a hair transplant and hair retention treatments?
So I like to broadly classify hair treatments as retention treatments and restoration treatments. So retention treatments majorly focus on retaining your hair, strengthening your hair, or delaying your balding. So under these retention treatments are your treatments where you can have supplements, you can have topical applications, you can have PRP, GFC stem cells of everything that has come now. Coming to restoration, where you restore something that you have lost. And if you've been bald for a very long time, that's what I would like to say simply. You go for hair transplant. So hair transplant is a surgical procedure where you take your own hair from a place where you have good hair and you keep it in the place that it is needed. So I would say this is surgery and this is a clinical procedure which is minimally invasive.
What is a hair transplant and how does it work?
So hair transplant is a surgical procedure. It's an outpatient procedure where for simply saying like in layman's term, it's like agriculture. Like you take a plant, a pot from one place and you plant it in another place. First all the leaves fall down and then the leaves come out. So it's majorly very similar to that. You take your hair, the root of your hair from the areas we call the donor. To be in the layman's term, it's a place where you're not going to have hair fall, majorly focusing on the backside or the beard. It can be chest, but we can get into that later. So we take it from these places and we plant it where it's affected, where you would want your hair to look good. So it's a surgical procedure which involves you going under anesthesia. It's not painful, but then anesthesia is involved, injections are involved, blood tests are involved, surgeon is involved. So yeah, that's hair transplant.
What are GFC and PRP treatments?
GFC and PRP, I would actually like to say they're both same. I know a lot of people are going to say no, but I look at it in a way like they're basically the same thing. You take your blood, you centrifuge it. Centrifuging is where you separate the ingredients in your blood, like your plasma from your red blood cells. So you remove your plasma and then you inject it in places where it is needed, where restoration or fixing is needed. So this, as a layman's term, is called your platelet rich plasma, your PRP. GFC is more of a marketing term, I would say. It's your growth factor concentrate. Some people use different tubes for it. They use different liquids where the concentrated mass from your blood is removed. Some people, it's just a way of selling it for a higher price. So if you look at PRP and GFC, I would say PRP is like your first layer of your blood, and GFC is a more concentrated version of it. Now coming to how good the quality it is, It's the way it is done. So in Max Hair Clinic, we have a treatment called GFC Fibrin Plus. So GFC is your plasma, your blood, and the fibrin is our product, where we have concentrated growth factors, we've got peptides, we've got nutrition, we've got vitamins and minerals, where it mixes with your GFC and then it is inculcated to the scalp. And how we are different from all other clinics providing GFC is because of the kit that we have. If you look at our the instrument that we use to remove your blood, it's completely different. We don't use regular test tubes. I'll get in detail of why we don't use regular test tubes, but this particular kit is designed to take the growth factors from your blood. So that's how we are different. So if you are comparing GFC and PRP is a bit more advanced version of your blood.
So, what are these advanced treatments, ma'am, and how do they differ from each other?
Okay, so this is very famous in the field of hair fall and hair treatments, PRP and GFC. So everybody has it. Does it really work? God only knows. We have similar treatments but advanced versions of it because we've been there in the field for 2 decades now. We should have learned our lessons by now. So that's how we came up with these tools. We've got 2 treatments. They're both completely different tools. So we've got Follicle Gen I 360 and then we've got GFC Fibrin Plus. So basically, what is the difference between these two? So your advanced PRP, which is your platelet-rich plasma, we process it using a kit called Follicle Gen I 360. So we've got our vitamins, we've got our customized growth factors where we mix along with your plasma and then we inject it. Coming to GFC Fibrin Plus, we've got a different kit where it's a 2-way kit. So if you compare it with a test tube, so test tube is something you see in your blood test labs. It's this glass tube with a cap on it. So normally in clinics, how they do PRP or GFC is that they take your blood from the tube. So when they try to take it, they open it and take it. So when you open the tube, your plasma gets exposed to the environment, so it gets contaminated. And this particular tube which you get in the market, your test tube PRP, this can get heated up during the process of it. So you take your blood, you centrifuge it. When you're centrifuging your test tube, it gets heated up. In heat, you lose half of your your nourishment from the blood because of your nucleus in your GFC bursting out, and then it doesn't work. But if you look at our kit, which we've got the closed casket, it's basically entry from one point and exit from another point, and it's made in such material that no matter how much you spin, we spin it at 5,300 rpm. So when you spin it, there's no heat produced. So because of its self-cooling gel, we are able to extract maximum good growth factor concentrate. So that is how your GFC Fibrin Plus and your Follicle Gen I 360 is way superior than your regular PRP or GFC that you find in the market.
Who is the right candidate for a hair transplant?
People with the right mindset, people who are understanding what they're going to expect from hair transplant. So first, when someone comes for hair transplant, I like to sit down and I like to understand what exactly they're expecting from hair transplant, because you can get hair transplant for all the reason. If you're coming for the right reason, hair transplant is the best treatment for you, because you cannot come for hair transplant when you have excessive hair loss. When you're young, you're losing a lot of hair. Hair transplant is not the treatment for you. PRP or GFC or retention treatment is the best treatment then. If you're coming for restoring something that you have lost, you've got good donor, you're medically fit, hair transplant is a good option for you.
Do you see more youngsters walking into your clinic and asking for hair transplants?
Yes, more than you'll know. I'm getting a lot of youngsters coming now for beard transplant. So this is a boom. Those days it used to be only men in their 30s, 40s, but now I've actually got clients 21, 23, young boys feeling their beard is not thick enough, feeling their foreheads too large. Mostly women used to not come much for hair transplant because there was this common taboo saying that you have to go bald for transplant. So women used to be scared of it because obviously we all love our hair, so we are not comfortable shaving it off. But now women come for hair transplant because of the advancements that is there in the field. We have techniques where you don't have to go bald for it. So yes, now we have got a lot of youngsters and women coming for hair transplant.
Is there an ideal age to consider a hair transplant?
I wouldn't say age as such, I would say stage, which stage you are in, proper balding, proper hairline recession, proper crown exposure. So it is a stage that you are in that you go for hair transplant. Obviously, underage is not something, you go for transplant. You try to first save the remaining hair and then you go for transplant. If you're way too young, it'll just be, me replacing what you've lost, but you continuing to lose what you have remaining. So I would say the stage, you get everything else under control and then you fill in the gaps.
So, what are some realistic expectations one can have from a hair transplant? Some ads claim that you can get your hair back in a month or two. Is that all true?
I would always tell my patients to be patient. So it's basically coming back to gardening. I recently watched this one movie, uh, Love Today, where they show this small kid putting this mango seed inside the mud, and every day he takes the seed out to see whether it's growing. It doesn't work like that. You've planted a seed, wait for it to grow. Average, it takes about 2 to 3 months to start, and about 6 to 7 months to appreciate the shape, the length, the density, and about 1 to 1.5 years for it to completely finish. And yes, a lot of other factors influence it: being young, being healthy, taking proper nourishment, taking treatments with your plasma. A lot of these treatments do help or influence the rate of it. But yes, it does take time and you'll have to be patient about it. No, it does not grow back in 1 month.
We often see ads saying get your hair back for 30,000 or 50,000. What is your take on such claims?
See, first of all, this is plastic surgery. Okay, this is not an emergency procedure where you're sick, you're gonna lose something, you go immediately, save up money, do surgery. No, this is something you're doing for your self esteem boost. So take your time, save up money, go for the good places, because now there's a lot of scam going on. 70% of clinics in India are performed based on technicians or nurses or unethical people and unethical tools. So imagine a plastic surgery with a plastic surgeon or a maxillofacial surgeon. How will they be able to give it for maybe 20,000 or 30,000? I heard a surgery was done for 15,000 in a particular place in North India. It's not possible. Where do you do cost cutting? You do cost cutting on the person performing your surgery. You do cost cutting on the tool that is being used for your surgery. If you're going for hair transplant, it is supposed to be a beautiful art. You're shaping your hairline, you're making yourself look good. There are actual beautiful tools used to get your desired result. And when you use these particular tools, surgeons are going to be involved because they've studied for it, they're masters of it, they're the only ones eligible to perform it. So when you've got all these good criteria or protocols, it will be slightly above 30,000 or 40,000. So these places where they provide 2 rupees per hair, I've seen in an auto there was it stuck like 1 rupee or 2 rupee per hair. It's not possible. I mean, you don't get quality. They say, if you buy it cheap, you buy it twice. So I would say don't fall for it.
Have you had clients who come in for a hair transplant even though they've already had one?
Yes, a lot of people come with failed hair transplant. They got this surgery from this particular place. They're there all over the country. They said, I give you cash back if it doesn't grow. And they come back with no hair. They try to reach back the clinic and nobody's responding. I've seen a lot of patients come back. Worse than that is they come back in such a way that it is very difficult to restore it, because mostly when you use tools, I've heard this one particular clinic in Chennai, don't want to mention it, they use 7 o'clock blades to do the hair transplant. So I did see one of a client with that kind of an output and it was completely scarred. So when you have a lot of scar on your plantation area, it's very difficult to replant in that particular area, because it's like, like your mud. If your mud is not good, your plant is not going to grow properly. Same thing. So all these kind of quack works, I would say, damages your scalp or your skin for further fixation. But yes, we have helped a lot of people restore back their lost hope, I would say.
Is hair transplant painful?
Yes, this is the question which a lot of people ask: is hair transplant painful? So, actually, hair transplant is, like I mentioned, an outpatient procedure, which means it does not require you being admitted in the clinic or hospital that you're getting it done from. This is a procedure which is done under local anesthesia, not general anesthesia, which means you will be awake, but a lot of people end up having a lot of pain after their surgery because of the way the anesthesia was administered. So if you look at Max Hair Clinic, we have separate anesthesiologists administering anesthesia for you. So when you have the right mix of anesthesia, the right dosage of anesthesia, and you choose proper patient selection for anesthesia, when the anesthesia is right, hair transplant is supposed to be almost minimally to nil. Pain is supposed to be experienced from the procedure. So no, it is not a painful procedure when the anesthesia is right.
During the extraction and implantation process, what is the one thing that sets your clinic apart?
I mean, first of all, you should see our theater. Oh, your mind just blows. So we are the only hair clinic where we have more than 3 operation theaters in one clinic. I mean, we have standalone buildings where, we have specified locations where these procedures are, taken care of. I've seen a lot of clinics where basically studios or salons where, they just get a plastic surgeon on board, they do it in any procedure room and then they leave, and then the patient comes back with some questions or doubts and, he doesn't get to meet his surgeon anymore. So the infrastructure in Max Hair Clinic is we give a lot of importance for patient comfort and patient privacy. So we've got proper operation theaters, we've got proper post-op rooms, we've got your lounges. So this is the base in any hair transplant clinic. And coming to the tools used, we give a lot of importance on how minimally people are going to notice that you've done something. So coming to hair transplant, there are 2 steps in hair transplant. One is you take the hair from your donor area, and number 2, you plant it where it is required. So for taking it, we call it extraction, and planting is plantation. So anywhere in the world, any hair clinic you go to, extraction can only be done by 2 ways. One is FUE and the other one is FUT. They're both good methods. I know a lot of people say FUT is bad, FUT is this. FUT is actually a very beautiful technique, but it has to be for the proper client. Like mostly I would say women are not comfortable shaving their hair. So FUT is a method where you just take one strip of skin and then you stitch, say from here, you take one strip of skin, you stitch your remaining place. From this strip of skin, you take the hair. So you don't have to shave off completely, just that one portion is trimmed off and stitched. So women mostly are comfortable with FUT. Or your donor is very less and just one, say maybe 3 fingers of donor, you go for an FUT scar beautifully there and then cover that scar with SMP or micropigmentation, it's done. So FUT is actually a very good technique. FUE is another technique where you just take that one particular hair from your root. So to be more layman term, I would say if you watch the movie Doctor, Shiva Karthikeyan's movie, there are 2 villains where, in the train scene, they fight and all. In that one villain, you'll see one line running. Or if you look at Elon Musk in his interviews, you'll see 2 lines running. These are FUT scars. So some people don't prefer it. We don't prefer it mostly in Max Hair Clinic. We go for FUE, but it's still a good method, but not that preferred anymore. Going for FUE, I've seen a lot of clinics where, the punch sizes, it has large punch size, like 1.5 mm punch size, 2 mm punch size. The larger the punch size, you're going to end up having a scar. Or the material of it. A lot of people use stainless steel. Some people use titanium. We use titanium. We use 0.8 mm punches. We use tools which, when you say you're going bald in the future, when people see you from back, it's not supposed to be evident that you've done something. So we use tools that selectively make it look like you've not done something. I mean, if you look at Avesham movie, you look at Fahad Fasil, they show him the younger version of him from backside with a knife he's posing. You will see he's done FUE. I'm not sure whether I can say it, but that's FUE. So they've used a larger tool, which is why it's exposed backside. So I would say going for the right tools will make your output look much better. So this is with extraction. Going for plantation, like I mentioned, some clinics use 7 o'clock blades. Some clinics use, injection needles, like 18 gauge needles. Why do they use it? Because patients come asking, like, I want my surgery and say this cost, I want 30,000, 50,000, I don't want to pay more than that. So cost cutting and tools is done when you don't use the right tool. The needles are going to cost you maybe 1 rupee or 2 rupee. So cost cutting in hair transplant is done when they compromise on the tools, because your needles or your blades are going to hardly cost you anything. But when you use the right tool, you're taking hair from a place where it is resistant to DHT. It is, in a layman's term, it is a permanent zone. So you're taking it from back, you're planting it in front. Majorly, it is not supposed to fall because it is resistant to DHT, provided you are using the right tools, the tools which don't crush your hair during placement. So at Maxa Clinic, we do have a lot of tools. We've got DHI, we've got IGM, but we also have Sapphire. So Sapphire is what makes us stand out.
Sapphire hair transplant. Sounds fancy. What is it, doctor?
Yeah, I mean, it is the advanced treatment in the field of hair transplant, basically coming down to what material it is. So the very common material used in hair transplant, or used to be used in hair transplant, is stainless steel or titanium. So sapphire is your crystal, it's your blue sapphire, your precious stone. So it is the stone which is cut in such a way that it gives you that proper snug fit. So it's a diamond shaped cut, and the size of it. So at Maxa Clinic, we have the size of 0.4 millimeter in diameter. So it varies in sizes as well. So why Turkey is because Turkey is where, I would say before Turkey, actually the European countries, where in, but then Turkey is the hub, so everybody goes to Turkey. It's like in Chennai, you got your Saukarpet. So it's like that in the field of hair transplant. So Sapphire is the latest tool where crystals are used to make incisions on your required area. So why crystal? Because crystal, because of its high carbon content, you can cut it very thin. So say 0.4 mm in diameter. So that's a crystals. Imagine cutting a metal that thin. A metal becomes wobbly. So you don't get angulations, you don't get the desired size or shape of what incision you're making. So because of this crystal's content, it's got the carbon in it, so it's going to be sharp, it's going to be precise, and because it's thin, you can make your incisions very close to each other, giving you the density. Or because it is thin, you can go as flat as you want towards your skin. Say for example, you want your hair here in the sides. Men normally lose the M shape, so the sides go back. This side hair for everyone grows flat. So when your tool is very small and sharp, you can go as flat as possible. So say 2 degrees angulation, you just slice the skin and place the hair inside, your hair is going to grow as flat as natural as possible. Say for example, your crown, the beauty of your crown is the spiral. In Tamil, we call it the suli. So when you're planting hair in your crown, you are expected to plant it in such a way that it mimics your spiral, which means overlapping one and the other, 10 degrees angulation, I would say. When it gives that image, that look, even with very less hair, you can give a lot of density. So angulations are very important when it comes to hair transplant. So the tool that can give you that angulation is Sapphire because of its thin nature. So that's why it's superior, and that's why I would say it's the latest advancement in this field.
Okay, all said and done. Using sapphire crystals in a hair transplant sounds fascinating. How does it actually help?
So I would say choosing the right material to your skin is very, very important. There's something called biocompatibility. So when it comes to metals, it's your gold, it's your titanium, but it's also your crystals. So blue sapphire, your precious stone, is highly compatible. So it plays in roles of healing. So your post-op healing, your scarring is very, very minimal because of its sharp cuts. And a lot of people believe in healing crystals. A lot of crystals heal. So we've got our crystals in this hair transplant because of its size, because of its precision, and because of its antimicrobial properties. A lot of people have very, very faster healing or post-op recovery when they use crystals in their surgeries.
Are there any side effects or downtime associated with a hair transplant?
So hair transplant is an aesthetic procedure, like I mentioned. So it has to be at the right set up by the right person, your surgeons, with the right tools, and to be done with the right patient. So you have to be medically fit as well. So when all these basic protocols are followed, you're not supposed to have side effects, because post-op medications are there to prevent any kind of infection. So when all of this are done right, hair transplant does not have any side effects, because it is your own hair from your own head just placed in a different place. So no side effects.
Is there any post-op care that people need to follow?
He has to first of all keep it safe. I have seen a lot of people after transplant, they're happy, they say bye, and they just go get hit in the door. So yes, I've had a patient where after he finished his hair transplant, while going out, he just hit his head on the door. So you have to be careful, number one, because it takes 48 hours for your graft to properly get stuck inside your skin. So safety, very, very important. Hydration is very important. So we give saline sprays. We've got post-op solutions where you spray it on your scalp to keep your scalp hydrated, because you've just planted the seed. Proper blood circulation has not started yet. So you keep it hydrated, you don't let it dry off. And then hygiene. Hygiene is very important. And obviously medication. So you've got your antibiotics to prevent any kind of infection. You've got your anti-inflammatory to prevent any kind of swelling or any reaction. So all of these are there. They play a major role in the proper growth of your hair transplant. A lot of clinics use topical solutions as vasodilation, like your minoxidil. A lot of people use supplements, growth supplements. So all of this are definitely playing a role in your hair growth.
Is post-hair transplant hair shedding normal?
Yes, it's normal. Like, I would always compare hair transplant to gardening, where you take one plant from one side, you plant it in another place. All the leaves fall first, most of the leaves fall first, and then you have the new leaf coming up. So hair transplant is very, very similar, because you take the graft from backside. So how does your graft actually look? The anatomy of it, you have the small follicle, and then you have the hair shaft, and then you have the hair coming out of your skin, surrounded by your skin and then your fat tissues. So when you're taking and planting it in the front, it's only the follicle that is going to actually get attached and start growing. So all the other stuff, your skin, the scab, the hair, all of them shed off. So yes, post-op shedding does happen. It sheds, most of it sheds, and then it grows back.
So say that someone is completely bald and doesn't have a donor area. What would you suggest for some people like that?
When he doesn't have a good donor but still wants to have hair, we have different options, a completely different department called the non-clinical department. So it's where we cosmetically replace your hair. But to know more, stay tuned for my next podcast. And if you have some more questions, drop them below.